Welcome back. In this video, we are going to start our exploration of muscles whose actions are on the lower extremity. And I want you to notice that I worded that carefully. I did not say all the muscles were in the lower extremity, but they're all going to have actions affecting the lower extremity. So the reason for that is this first set of three muscles, they are actually located in your trunk. But because they cross the hip, their actions are going to be in the affecting the hip joint or the thigh. So these are the deepest muscles found posteriorly. So what this means is we would go deeper than the trapezius, deeper than the erector spinae muscles, and then we would see them. However, we never look at them from that direction. The way we find them is we take an anterior approach where we go through the anterior abdominal wall, and then you take out all the organs on the inside. And now you're looking at the posterior aspect or the deepest aspect of the abdominal cavity, which is the anterior aspect of the posterior abdominal wall. So this view. Okay, so there's three muscles here. The first muscle is a quadrilateral. So it's called the quadratus lumborum, thereby telling you it's in the lumbar area. So this one, if you look at this middle picture, you can clearly see the origin is the medial part of the iliac crest, and then the insertion is up here on the 12th rib. Okay. So the quadratus lumborum is quite easy to see on this type of a picture, but when you look at the bottom right picture, what you will notice right away is there's kidneys sitting on top of it. And so you're not seeing the entire muscle. What you usually can see is just the part that's outlined there in teal, which is the inferiormost aspect. So you can always tell if you're looking at the right muscle. If you look at the iliac crest and you have a muscle going parallel to the spine in an upward direction towards the 12th rib. Okay. Does not go below the iliac crest. Now that you've found the quadratus lumborum, what I want you to do on all the model pictures, and like here on the lower left, where the quadratus lumborum is, I want you to go medial to it. And you will see a muscle which is coming off the spine, but actually crosses. It doesn't stop at the iliac crest, but actually goes through the iliac area into the hip area. And this muscle is called the psoas major muscle. And yes, there's a little tiny psoas minor muscle, but you don't see it on any of the models. We're not going to learn about it. So the psoas major muscle. So on this picture on the far right, it's pointing to the psoas major muscle, say above the iliac crest, going lateral, that would be your quadratus lumborum. Now, stay lateral to it, but stay in the iliac area, and you can see that the whole iliac fossa is filled by this muscle, which also travels deep to the inguinal ligaments. So both of these are going to go here in the upper thigh area. And this third muscle is called the iliacus muscle. So in this middle picture, you can see that below the inguinal ligament, we have the iliacus muscle right next to the psoas major muscle. And it's really hard to tell them apart. And so when you're reading your textbook, they may be talking about the iliopsoas because that's that area below there. So for me, for tagging them for practicum and quiz questions, it will be the iliacus muscle or the psoas muscle. Do not write iliopsoas and expect to get credit because above the inguinal ligament, you clearly can tell which one is which. So what I've just introduced you to are three posterior abdominal wall muscles. As you clearly can see, the iliacus muscle and the psoas major muscle cross, and they are both going to be inserting onto the femur, thereby giving us a hip action. So yes, that quadratus lumborum muscle does not have a lower extremity action, but because it is adjacent to those other two muscles, that's why it's covered here. When the quadratus lumborum muscle contracts, it is going to pull down on the 12th rib, thereby lowering the rib cage, increasing the thoracic cavity. So it has a function related to some forced inhalation. All right, so that's it with the abdominal wall related muscles. And so now let's look at another area that is posterior, and that is going to be the buttocks area, where we have a bunch of gluteal muscles. We have 8 muscles, but we're not going to be learning 8 muscles there. We're only going to be learning 4 of the muscles there. So the other little ones you don't have to learn about. And then we're going to learn about one related structure, which really helps you figure out exactly where you are. So that's why we're learning that structure. And it's already a structure you've learned. We're just putting it in its location with the muscles. So the first muscle, the one that everybody's always talking about when they're talking about your glutes, this is the gluteus maximus muscle. So we're going to have 3 different gluteus muscles. We're going to have a papa bear, a mama bear, and a baby bear. So the gluteus maximus muscles, what I want you to realize from this picture, look at any of the pictures, you will notice the direction of the fibers is kind of at this oblique angle. Okay. And if you look at the entire butt cheek area, you will notice that this upper outer part of this butt cheek is actually not covered by this gluteus maximus muscle. There is a different muscle there, and you can tell because the angle of those fibers is going to be upright as opposed to the oblique angle of the gluteus maximus muscle. So pulling off the gluteus maximus muscle, let's just see the mama bear. And the mama bear muscle is the gluteus medius. So if you look at the picture on the far right, you clearly can see the angled gluteus maximus and then the more straight up and down gluteus medius muscles. And then you can also see it on the left side of the model in the middle. On the far left, the gluteus maximus muscle has been removed, so all you can see is the gluteus medius muscle. So notice that the gluteus medius, the origin is completely from right where the iliac crest is. Okay, so angled gluteus maximus muscles and laterally easily seen with the gluteus maximus still there, easily can see the gluteus medius laterally. And then of course, if you take off the gluteus maximus muscle as you can, for instance, right here, this piece comes off, then you will be seeing gluteus medius muscles. Now students get confused between the gluteus medius and the gluteus minimus because most models do not actually show us a gluteus minimus. They're actually showing you a gluteus medius. So if you remember that I said the gluteus medius, its origin is all the way up there at that iliac crest. The gluteus minimus's origin is not. Its origin is about ½ an inch to an inch below. So it's very clearly seen in the cadaver dissection on the left where you clearly can see the iliac crest up there, but the gluteus minimus is quite a bit lower down. And on this particular model, you can see the iliac crest here, and you can see that the gluteus minimus does not extend all the way up there. So that's gluteus minimus. And then the last muscle we want to learn is the muscle that is just inferior to the gluteus minimus. And that muscle is a triangle in 3D, which is called the piriformis muscle. Now, I have chosen model picture that specifically shows a gluteus minimus, but look at the other model pictures because and actually let me go back. For instance, this one here on the gluteus maximus page here in the middle, where on the left is the gluteus maximus, you see the gluteus medius, and on the right they have cut a window in. And at first glance, you would think, oh, that must be gluteus minimus because there's the piriformis. This actually is still gluteus medius muscle. They just haven't removed it. Whereas in this model, it has been removed. So on a lot of the models, you're not going to be seeing gluteus minimus. So how can you be sure if the muscle you are looking at is gluteus minimus versus piriformis? That is this white structure, which on most models, I'll tell you, is usually yellow, but on this one is white. And that is because what normally comes out just inferior to the piriformis muscle is the sciatic nerve. And with that, we are done with this section of muscles, and I will see you again soon as we move into the thigh area. Thank you for all your work.